Honorable Prime Minister is extremely knowledgeable now on vaccines and vaccine production. We were amazed with what he already knew. There was very little to explain to him except to go into detail on the different variable vaccines and the challenges that we may face ahead in terms of regulatory or whatever else. He was also very impressed, of course, to answer your question, on the new facilities that we've built in record time. In fact, we've added a third facility also that we showed him so that we can handle more than 1 billion doses a year starting very soon. So this vaccine is a very good one because in the trial, not only did we get a good efficacy result, but also reduce the hospitalizations by 60%. So there was 0 hospitalizations for everyone who took this vaccine, which is great news. What it reduced by 60% is the virus in your system. So, there are vaccines that protect you, but you can still transmit the virus to others and infect others because you have a part of that in your system when you're infected. But what we found with Covishield is that in the trials globally is that there were 0 hospitalizations, which means that even if you do get infected, you're not going to have a severe attack. And secondly, even those who got the disease, were not infecting others. So the sterilizing immunity, that what we call sterilizing immunity, was about 60% reduction, which is also a very good bonus to have for a vaccine against a disease which is so infective. Well, with so many different vaccines, we discussed and briefed all the merits, the pros and cons of different vaccines that are out there, with the logistical issues of some of the vaccines, the pricing issue with some of the vaccines. And, they'll really have to take a very balanced view of how that's going to happen. As of yet, we don't have anything in writing with the government of India on how many doses they will purchase, but the indication is 300 to 400 million doses by July 2021, which is what the health ministry has made public, on various occasions in the past. So as I mentioned, we're in the process of applying in the next 2 weeks for an emergency use licensure. So we'll have to wait and see after that. And as I said, things will then follow in that order. Well, it'll be distributed initially in India, of course. And then we'll look at the COVAX countries, which is mainly in Africa. The UK and the European markets are being taken care of by ASTRAZENECA and Oxford. If they need help scaling up with their manufacturing, we're always there to support them, but our priority is going to be India and COVAX countries first. So NOVAVAX is around 2 months behind ASTRAZENECA. Once they also announce their efficacy results, we will do a short bridging study in India like we did for the Oxford and AstraZeneca product. And that soon also in 2 to 3 months will follow the same processes that this candidate is doing. Of course, Codogenics is far behind. We're going to start phase 1 in the UK for Codogenics in December. And so that will take 1 year to be licensed because it's only starting phase 1. So that's far behind, of course, NOVAVAX and the Oxford products.